Hello and happy Nurses Week 2026. This is Dr. G at the Heart of Healthcare, and we are observing a wonderful week with a leader in the community, Liana Shahijani. She's a nurse practitioner. She has a home health agency, Reverence Home Health, and she's going to help us this year when we observe. Welcome to the podcast.
Thank you so much. Thank you for having me. Happy Nurses Week.
Hey, what kind of stuff you have planned?
Just seeing patients, getting the home health, where it needs to be, which it already is, and just, thanking nurses for everything that they do, especially the ones that work with me and the ones that work in the ICU and just all of that. Just being very grateful for this opportunity.
Oh, that's wonderful. Well, let's just jump in. So, I looked on the American Nurses Association website and learned what the theme is this year, and I love it. That's why I'm wearing this shirt, Greatness. It's the power of nurses. I love that. Power has been something that's resonating with me about harnessing your power, because when we do that, I think we can do great things together, hence the Greatness shirt. So let me just read this little blurb for our listeners, and then we'll get into your story because you're an expert and you're a valuable resource today. So let's see. They said they're thrilled to celebrate Nurses Week and recognize the invaluable contributions nurses make in healthcare and our lives while addressing the real life challenges they face every day. And this year, the association celebrates the 130th anniversary as America celebrates the 250th year. So we're honored to play a key role in elevating nurse voices, stories, awareness, engagement, and local celebrations in coordination with sponsors and partners. And so Nurses Week is always from May 6th to May 12th. And then I actually learned it's actually Nurses Month. So anyway, you guys get all that stuff. We only get a doctor's day that people forget. We always joke about that.
Yeah.
Anyway, so we'll jump in and we'll follow that hashtag around. And I have this other link that I'll include in the show notes just with an article about the history of Nurses Week. And so if you want to enjoy that, you can, and just be encouraged about the power of nurses. I know just from being in healthcare that we've lost a lot of nurses just from burnout and the pandemic, but also wonderful ones that have stayed and innovated and started new businesses like Reverence, and they're leading our communities. And so thank you for staying and leading. So I want to say that to you as a friend.
Thank you so much. I love what I do. I don't think I'm ever going to stop doing this, to be honest.
All right. Well, before we get into your story, or you can include it, tell us a little bit, a mini bio of yourself. I know you have a bio, but give us a little bit, the 30-second background. Where'd you grow up? I know we have the UCLA thing in common, so tell our audience.
So my name is Liana. I've been a nurse for going on 19 years this year. I grew up in LA, and I graduated with my ADN program from Rio Hondo College. And then I received my bachelor's from University of San Diego, the only school that I applied because I wanted to get out of LA so bad. I fell in love with San Diego, and I fell in love in San Diego, and then had to move back to LA for my master's in nursing and nurse practitioner certification. Worked in LA for a couple of years, then decided, we're going to get married and move back to San Diego. Came back to San Diego, worked as a nurse practitioner, worked as an ICU nurse, and then finally decided to open up a home health agency to be able to take care of patients with all of the experience that I had gained for so many years. And here we are with Reverence Home Health and ICU nursing, and just loving what I do. And so that's my little bio there.
That's fantastic. And I know I've seen on your social media you running around to ballet recitals. So we can't keep the family out. I keep my family photo right
Yeah.
there. That's my graduation. Tell us about your little ballerina. How many little ones
Sure.
do you
I
have?
have I'm happily married. I love my husband very much. He helps me so much with everything and the kids, which is why I'm able to do everything that I'm doing. I have three amazing girls, 6, 9, almost 10, and 11. One's in volleyball, competitive, and two of them are competitive rhythmic gymnasts. So we're, back and forth almost every single day, after school. And so it's very busy, but I love them so much. They're, learning so much about home health also because of me. So that's, my family life. We love the beach. We love hiking, and just listening to music and having dance parties at home.
Sounds like a wonderful quality of life. All right. Well, thank you for sharing that. And we appreciate you. It just shows how, women professionals, we do a lot and in our careers and family and having work life integration is what I call it.
Yeah.
And we're here. So I'm here to talk about that. So okay, let's jump in. So tell us how you decided to become a nurse. I always like to hear that.
Very interesting. I was at a community college, still deciding what I really wanted to do. I knew I wanted to be in medicine for sure. I just didn't know if I wanted to go the MD route or the nursing route. And then I sat in calculus class for one day and I said, that's not for me. No. So
I
that was
get
the day
it.
I said, yeah. And I said, you know what? No. And that I dropped all of my classes and I said, I am doing nursing. And I never looked back. And now looking
Wow.
back at that day, I'm like, that one day changed everything for me. And I
Hmm.
enrolled in everything that I needed to enroll in to become a nurse. I
That
applied the
day.
first. Yes, I changed everything. I don't know how I got into the classes because they were so full, but I got into the classes that I needed to then apply to nursing. And so I finally, I applied. I didn't get in the first time around. I applied again, and that's a whole different story on its own on how I even, got into Rio Hondo College. I had never even heard of it before. I heard of it from a nurse in the emergency department taking care of my dad. And I
What?
was like, mm-hmm. And if I didn't take my dad to the ER that day, I would have never heard of it. And I applied and I got in, and the door just opened from there. So got into nursing and never looked back. And I'm so grateful for this profession, for everything it has taught me. Um, it has just, humbled me so much. And I absolutely love what I do in nursing.
Hmm.
So
I'm
that's
so
how I got
glad you're
into
a
nursing.
leader. I love that. You and I have a lot in common. We're going to have to talk about that if we ever get around to our little lunch date. We're just kind of
Yes.
online friends supporting each other in the
Yeah.
community. So I love that story. What I want to ask, this is just a question that popped up from you saying that day you said no. And of course, we laugh about these classes that block our way, but those are pivotal points. What do you think it was in you that helped you have the strength and the courage to pivot? Because a lot of people I know and I have witnessed, they will just go through with a career because their parents want them to or whatever, and they don't do it. So I as a mom, well, my kids are grown, so I'm beyond that. But you're a mom. What is that thing
Mhm.
that's in someone where they have that courage or strength to do that? And how do you see that in young people? I'm just curious from your perspective.
Yeah, my parents were never the type to say, you better sit down and study. You better do this. You better do that. They were never like that. They allowed me to just be. And I have two older sisters that both have their master's degree, that both, went to school and did very well for themselves. So I kind of looked at them. I said, no, I have to do something with my life. So after high school, I have to go to college. I have to do this. I have to do that. And then when I got into that calculus class, that was just a wall. Like I was not gonna get past that wall because that was just not my passion. Something just switched. And then, and I was young too. My study habits weren't the same that they are now. So like, if even if I were to do it, maybe I wouldn't have done so well. So back then I was like, you know what? No, I'm gonna do something that fulfills me, that allows me to study, that allows me to kind of challenge myself in ways that I want to be challenged, not forced to be challenged. So, my parents, my sisters played a huge role, and then once I sat in those classes, nursing classes, it was just up from there. So I think, just not like being too stressed by like my parents. I think, that really set the tone for, nursing and the profession.
Fantastic. Sounds like you have great family support. Wow. Well, thanks for sharing that origin story. So then the part two of it, how did you then decide to continue your education and go for the advanced training to become a nurse practitioner?
Sure. So after my ADN program, of course, I knew I had to get my BSN, my bachelor's in nursing. There was, I have two sisters with a master's degree. I can't be the little one with a bachelor's degree. So I said, let's keep going and I'll get my master's in nursing. But I had never heard of a nurse practitioner. I'd never heard of that. And someone in my class said, yeah, I want to be an NP. And I said, what? What's an NP? And then I started researching that. I said, nurse practitioner, huh? Interesting. So after my BSN, I had already applied to the master's program. And I said, you know what? We're gonna do this. And I got into the, NP program at UCLA and I loved it. It really brought in everything for me, from the bedside nursing to actually diagnosing and treating and doing the entire H&P and follow through with the patient. It was just so wonderful that I was able to do that. So it was, one of my colleagues that said, hey, nurse practitioner. I said, oh, okay, cool. I even once thought maybe I'd go the CRNA route. Things changed and I didn't. And I'm very happy with the NP program. And so that's why I decided to keep going, to be able to provide care for patients, as a family nurse practitioner from cradle to grave. That's what they say. And so that's how, I got into the master's part of it and the nurse practitioner part of it.
That's wonderful. You've had the whole journey, and that's good for people listening because a lot of people are contemplating it, and it's, they have, everyone is in different places in life. Some people can take the leap, some people can't. Some people think they can't take the leap with children. So
Mhm.
it's good for them to hear these stories. Okay,
Yeah.
so now unless you want to share anything else there, feel free to. Then how do
Mhm.
you then take the leap to start a whole home health care
Wow.
agency? That's
Wow.
amazing.
Yeah, that was a big leap. So once I started working, when I knew I was done with school, I just wanted to work. I didn't even think about, having a home health agency. I didn't even think about, business side of things. I just wanted to work and take care of patients and their families. That's it. So I started working in pulmonary critical care. That opened huge doors, lots of knowledge that I gained from the one physician that took me on as a new grad and taught me a lot, a lot. And I had privileges at two different hospitals and seeing patients in the clinic and doing consults and discharges and admissions to the hospital, to home, all of that. Referring to home health, even, from the hospital. Still didn't think about it. From there, I had all this experience, in pediatric medicine, in emergency medicine, which I loved, absolutely loved. Urgent care, ICU, I mean, you name it, family practice. And then one day I was just thinking about it. It was COVID had already started. And then afterwards, once things, started to open up again, and I was like, I don't know, I kind of like this home health idea. But before COVID started, I was doing hospice as a nurse practitioner. And that really, I remember telling my husband
Yay.
the first day, yeah, yeah. So the first day in hospice, I was going to these board and care facilities, RCFEs, and that was a whole new ball game for me. And I told my husband, I said, I don't know what this job is doing, but I feel it. It's going to open a door, something that I just don't know. And so I went with it, and I did that for 5 years. And I went to patients' homes. I went to skilled nursing facilities. Assisted livings, boarding care, RCFEs. And then one day I said, I think I can do this, but I think I want to keep the patient home, out of the hospital. So how about I just start researching on how to open up a home health agency? I mean, so many people already had one. My parents were patients of one. And I said, I'm just going to start researching. And, I did. I started reading the law. And that was where I started. One step, one foot in front of the other. And then, setting up a corporation and having policies and procedures and an office and all this. And I said, I can take the experience that I have as a nurse and as a nurse practitioner and take it to the patient's home and improve outcomes and keep them at home and out of the hospital. Because the second you step foot in the hospital, you're gonna decline until you're not, you know? And then hopefully we get you back up and running and, functioning again. But still, some patients need the home health agency to come in, and the nurses and the PTs and the OTs and the doctors to come in and help the patient regain their strength and be able to be independent at home. And I loved bringing all that together, especially as a family nurse practitioner with so much experience in different fields. Bringing that in, I think, would benefit, the community as a whole.
Your story is so inspiring. Like I feel wow. That I'm just going to say wow. You know, I, I
Thank you.
have some more extra questions after that because I didn't realize your story did that. So I'm going to say bravo to the hospice stuff. Help our listeners know we've already done a podcast on this in a previous season, but the difference between home health and hospice, and when
Sure.
it's time, like maybe someone's had all these hospitalizations. Everyone knows that I talk about that on here. They know about the article I wrote, Mapping the End, where I want people to do advanced care planning better, to age and die in bliss. We talked about that on National Healthcare Decisions Day. Now we're in episode 3. What's the difference between home health and hospice, and how do you know when, maybe if you've been getting home health, it's time? What would you share about that for
Yeah.
people?
Yeah. So hospice, the patient and the family, they are, ready for end of life. They don't want any further care. They know that they're going to decline, they know that they're in the direction of passing away, and they don't want any interventions to be done. They are done going to the hospital. They don't want chest compressions. They don't want that pain. They just want to leave this world comfortably. And that is hospice. And hospice nurses and doctors do that, and social workers and the aides. Everyone helps them to to come to the end of life in peace and comfort. Home health is so what home health does is we get them better. The goal is to get them better, keep them out of the hospital. Sure, if they want chest compressions, if anything happens, we can do that. If they're do not resuscitate or DNR, we can do that. But our goal is to rehab them. Our goal is to get them better. If they had hip surgery, they're relearning how to walk. We help them relearn how to walk. The PTs and OTs come and help do that. If they were in heart failure, they have new medications on board. And if they're constantly in and out of the hospital, the home health nurse can come in and teach them what they need to monitor, all the new medications and the education that go along with it. We not only teach the patient if they are teachable, but the family and the caregivers as well. So that's what home health does. We rehab them, or maybe they didn't have a fall. Maybe the hospital doesn't want to keep them in the hospital because they're going to be on IV antibiotics only, but they're dischargeable if an agency is willing to take them to provide the IV antibiotics and PICC line or whatever catheter that they have at home. That's what home health does. So in home health, when a patient is ready for hospice, so let's say they've had a fall or they've had multiple hospitalizations for heart failure or lung failure or whatever it may be. Now, you're having a difficult time. They're elderly, they just keep ending up in the hospital, even though they're, on home health services. And now you're just like, okay, the disease is progressing way too fast, for what I can do to keep them home. You have to have that conversation with the family. Like, what is your goal? Because at some point, home health is going to have to discharge, and we're supposed to discharge because our goal is to get you better. There, my hands are tied. I can't get you better. So this is where we say, okay, do you want to go towards hospice? What would you like to do, and educate them on that. Some patients and families are ready for that. Maybe they didn't even know what hospice was, or some patients are just not ready for it. And they just say, okay, well, discharge me, we'll figure out what we're going to do. But, getting people involved to teach them about other services that are available, I think is crucial in their healthcare, and to be able to transition them where they need to be for the best outcomes.
That's wonderful. You said it so beautifully and clear. So I know all your patients, they are receptive to your education, and they do those, different pathways of care when needed, getting the right care at the right time.
Mhm.
That's wonderful.
Yeah.
Thank you for sharing that. You have such a breadth of experience. And, you know, since you said it, you know, I am going to be publishing that pocket guide for nurse practitioners for Nurses Week. Surprise. I'm sure you all saw it a couple years ago, but it's coming out this week for Nurses Week, because nurse practitioners are vital members of the hospice interdisciplinary team, doing those face to faces and even treating patients. And there's not enough hospice physicians, and so we need you and we need each other. And so thank you for sharing that story so beautifully. So now, well, what would you say then, while we were preparing for this podcast, Liana kind of, ooh, she pulled my heartstrings, dropping gems. So you've already shared, why home health is important to the healthcare system, and those things. We covered that. Um, if you had to just say one thing, let's get back to the nurses because we're celebrating you. What would you say to them, to encourage them? We know they're out there working, they're running their kids around, they're doing whatever, going through a divorce, doing juggling, all the things. Life
Mm-hmm.
happens. What would you
Yeah.
share with them just about the profession, the
I
power of
think,
nurses?
yes, the power of nurses. Um, Number one, I want to say that you are not working for a business. Okay, healthcare is a business. You're not working for the business. You are the business. You are. You are the one that keeps everything afloat. There are so many things that nurses know that the charts will never show you. Never. And so you have to continue learning. One of my first nurses, my nursing instructors, that one day told me, the day you think you know everything in nursing is the day you should quit nursing, because you will never know everything. You have to constantly keep learning. Learning. There's new things that are coming out, learning whatever your nursing journey, wherever it's taking you, whether it's hospice, hospital, aesthetics, anything, home health, even, keep learning and know your worth. Know your worth. You are the voice of not just the patient but the family. So, you know don't accept someone that just says you're just a nurse. You're not just the nurse, you're the voice of the patient. So
Ah,
keep learning, keep pushing. Know that you are the business.
mhm,
You're the one that keeps everyone on float. You're the one that knows that something is wrong before the vital signs even show you that something is going on.
mhm,
And without that, no one would know. So trust yourself. You will gain that confidence. You will gain that skill set. If you're a new nurse, just keep going. It's a wonderful field. There's so many different opportunities. Don't let one thing stop you. So that's what I'd have to say to nurses.
Mic drop.
I
You
do
said
want to
it.
say one quote that I actually it's on YouTube. You can find my I was the class speaker for UCLA, but anyway, this quote never
I'll put a
goes
link
away.
in
And
here
I
if you
always
want.
sure. um this quote, like it lives within me. Okay, so nurses are the first to hold a baby or the last handheld when someone is dying. It is the passion of caring and the commitment to be the best that sets nurses apart. So don't forget that. That's what I have to say to nurses.
And that made my tears well up. The power of nurses. We have to know our power. You said it. We have to know our worth. Well, just as human beings. Obviously, I'm not a nurse, but you saying that just reminded me of times, where, I'm relying on, in the work I do, being on call as a hospice physician, I'm relying on a nurse, like asking questions because I want to do the right thing. I want to make the right decision. And they are the eyes and ears. They are on the front lines. And so, um, I love that. And I hope they know their power and that, we work together to to have the best outcomes for these patients and families. So thanks for sharing that.
Of course.
All right. Well, you are the valuable resource, Reverence Home Health. The website will be linked in the show notes, reverencehh.com. And this has been a wonderful observance for the year. And so I'll
Thank
put
you
the
so much.
links
This
to
has
the
been great.
Yeah, I'll put the links to those things in the show notes. And we just hope y'all have a fun week partying out there, celebrating yourselves, and hope this recruits more great nurses who are committed to uh, people. It's about people at the end of the day. You are not in business, you are the business of care. And so, all right, thank you so much for being on the podcast. Any last
Thank you
words
so
before we
much.
go?
Happy Nurses Week.
All right. Well, peace out. We're signing out in episode 3 of season 4. Peace.